Thank you. I think just to keep us on time a little bit, that we'll just go directly to Anne's talk. And what I'm doing is I'm kind of holding up the 5-minute hand wave. So when you see me waving over here, Anne, you'll know what I'm doing when you have 5 minutes left, okay?
Okay. Good morning. Good morning.
Good morning.
Yeah, that's more like it. So I'm just going to describe the Kenyan Ministry of Health, how it operates, and how it looks at PPPs. How does this work? Okay, yeah, got it. Okay, so Kenya is a country of champions. And so we have our champion there, he's called Eliud Kipchoge. I think all of you know him. He's a world record holder for the marathon, and he just broke his own record the other day by running in under 2 hours. So I thought I would just, start off there. So I thought I would put that out there just as a way of background. The Vision 2030 in Kenya is a blueprint for Kenya's development plan. And it's very ambitious. It's based on 3 pillars: the economic, the social, and political pillar. So this was launched back in the year 2008, and there are quite a number of flagship projects in there. And the government realized that if we're going to achieve those flagship projects, then we need to reach out to the private sector, because the resources within the public sector would not be enough to achieve the goals in that Vision 2030, therefore laying the framework for public-private partnerships. So that's the Ministry of Health where I work. And within that ministry, those are the 2 guiding documents that guide what we do: the Constitution of Kenya 2010 and the Kenya Health Policy for the period 2014 to 2030. The Constitution of Kenya guarantees every Kenyan the right to health of the highest attainable standard. And it also states that health is a devolved function, meaning that delivery of healthcare is vested in the regions, the counties, what we call the county governments. But the national government has a role in terms of policy and capacity building those counties to deliver on healthcare services. The Kenya Health Policy describes the policy objectives and the goal of the health sector. So the overarching goal of the health policy is to attain the highest possible standard of health in a responsive manner. And if you look at the policy objectives, I want to draw your attention to the last policy objective that talks about collaboration with the private sector. And I'll just go a bit more into what that means. So if we're going to strengthen collaboration within the private and other sectors that have an impact on health, then we need to develop a public-private partnership in health policy framework to guide that engagement. And then there's need to establish appropriate legislative frameworks and guidelines to facilitate that engagement with the private sector, working within the existing laws and regulations. Then we also need to incentivize the private sector to be interested in working within the public sector. If you look at the policy orientations, I'll just draw you to one of the bullets there that talked about promoting private sector participation in financing. Because if you're going to finance healthcare, then we need to reach out to more than just the public resources. So really, I just put out there to show how we are ready to engage with the private sector to deliver on the goals of the health policy in the country. So this is the current structure of the Ministry of Health. It's divided into 7 directorates, 6 are technical and 1 is administrative. So the directorates work under a Director General of Health. We have the Public Health Directorate, Healthcare Services, Preventive and Promotive Health Services, Health Standards, Quality Assurance and Regulation, Policy, Research, Monitoring and Evaluation. And lastly, we have the Health Sector Coordination and Intergovernmental Relations. This is the one that ensures that we work closely with the county governments to ensure that they deliver on their goal of healthcare service delivery. So if we zero in on the Directorate of Healthcare Services, which is where I am based, we have 3 departments. One is on national health system strengthening, the other one is on national blood transfusion, And the last one is Department of Health Infrastructure Management, where I directly work under. And there we have two divisions, Capital Investments and Project Management. And then we have the Division of Healthcare Equipment, which I head. So within that directorate, we look at improving access to and quality of care, which is people-centered. And we talk about developing appropriate policies and guidelines, and also looking at norms and standards. And we do provide technical assistance and capacity building to the counties, looking at issues of healthcare service delivery, capital investment, healthcare equipment, and project management. All this is done within a framework of national health system strengthening, and this was alluded to by the earlier speakers, because we must strengthen health systems if they are going to deliver on their mandate. So if we look at public-private partnerships in Kenya, how does this work? We do have the legal and institutional framework. So in the year 2013, we enacted the PPP Act, and it was reviewed in the year 2015. This act describes the PPP process, and it forms the legal basis for identification of PPPs, and my colleague is going to talk more about this. How do we determine what PPPs we engage in as a health sector? So first, it needs to be part of the National Development Program. And as has been said before, Kenya is currently implementing universal health coverage. So basically right now we are looking at projects that are going to help us implement universal health coverage. So we need to do a feasibility study to look at the technical requirements of that PPP, what would be the legal requirements for both parties, what is the socio-economic and environmental impact, and then looking at affordability, value for money, and how it compares to a public sector implemented project. How then do you learn about what PPPs we are doing as a health sector? The ministry would then advertise for this and pre-qualify bidders. This would be found on government websites or in the print media, and usually both national and international bidders are welcome. And apart from requesting for expressions of interest, we do also look at unsolicited PPPs based on how they're going to help us achieve our objectives. How is the PPP structure? Again, this will be described more by my colleague, but this is based at the National Treasury, and we do have a committee and a unit. So the PPP committee is led by the principal secretary at the National Treasury, and this is the main approval body, which ensures that all projects comply with the Act and they align with national priorities. The members are principal secretaries from various government agencies listed there. You have Treasury, coordination of government functions, national planning, lands, county governments, Attorney General, and 4 other members, and also the director of the PPP unit, which I'll talk about briefly. So the functions of this committee is to set the PPP policy, to approve the feasibility studies that need to be done to ensure that a PPP gives value for money to the government. And then it designates which projects are eligible for PPPs, gives the final approval, and also oversees the work of the PPP unit. So this is the unit now which is really the heart of the PPP, and it serves as the secretariat and technical arm of the committee, and usually provides the technical, financial, and legal expertise. It also makes sure that it promotes awareness about PPPs and conducts capacity building to various government agencies to ensure that they all understand what the PPP framework looks like, and that government agencies are able to monitor and evaluate PPP projects. It serves as a secretariat for the national and county governments' PPP projects inventory, and it also acts as a screening body for requests on information and government support. It's responsible for identifying and supporting performance improvements efforts within the PPP program, and it does the risk analysis of PPPs which have a budgetary implication. It makes sure that it monitors contingent liabilities and accounting issues of PPPs. And then on behalf of the committee, it makes sure that PPP guidelines are enforced and implemented as should be. I've mentioned that we have a devolved system of government, so I was asked to say, how do counties engage in PPPs? So counties can contract and engage in PPPs so long as they are within the PPP framework and they follow the laid down laws and guidelines. But then the cabinet secretary then would have the final approval to make sure that they don't engage in projects that are going to cause liabilities to the national government. So I think I needed to just put that out there. Then I was asked to say how we make sure that, as we implement these PPPs, that Kenya is getting a good deal. And so the first thing is to ensure that we have adequate capacity within the public sector to negotiate for these contracts. And so if we determine that there isn't enough adequate capacity, then there's provision for hiring a transaction advisor. And then also the PPP unit may assist the government agencies to ensure that you have the required skills to negotiate for this deal. We also have competitive bidding, there's adequate risk transfer, and then ensure that contracts that are signed are fully enforced. So this is my last slide. So within the health sector, how do we then take the PPPs? Again, it's going to be guided by the framework of PPPs using the laid down laws. And we just ask ourselves a few questions. Is that project providing good scope and background for private sector innovation and efficiency? Will it allow enough risk transfer to the private sector? And will this show demonstrable risk transfer? And currently, we are really focusing on equipment and maintenance. The earlier speakers mentioned about maintenance of equipment, especially in public health facilities. So currently, we are looking at that so that we ensure that we have constant and consistent uptime of equipment so that they're able to deliver on services. So the example you will hear from Kenya is about equipment and how you make sure that healthcare services are delivered full-time. UHC is driving most of our health decisions, so any PPP that helps us implement the UHC is top on the agenda. And finally, capacity building is key, just to make sure that once this PPP is implemented, then there's local capacity that is built, and we encourage this skills building to be done both locally and internationally. So that is my last slide, and thank you very much for your attention.
And that was a great overview of the process in Kenya, and I think that that's going to give us a lot to build on. I was particularly struck, by how that there's a law and it's regimented, and there are committees and units, but also that the foundation of it all is to reach the 2030 goal of UHC. So that's I think something that we can all get behind and feel that the use of the private sector to reach those goals is really important.